Hi there. I'm Dr. Jody Mullen. I'm a professor of counseling and psychological services at the State University of New York, College at Oswego, and the CEO of Integrative Counseling Services. I am a licensed mental health counselor and a credentialed play therapist. And I want to talk to you today, if you have a couple of minutes, because that's all it'll take. But I really think that what I'm going to be talking to you about today, um, will change, impact, help you navigate the way you think about working with children, and maybe even the way you think about working with clinically with teenagers and adults as well. So here's what happened. I was reading a book by Gabor Mate, and I realized it was called The Myth of Normal. And I definitely recommend the book. It takes it takes some time to read it, but and there's so much in it. But there was this one piece that really captured my attention and made me think about the work that I do as a child-centered play therapist in particular. So Mate talks about that as children, we are in this constant sort of a battle between authenticity and acceptance. That if we are authentic with our parents, that we may not be accepted, and we need acceptance to survive. And by doing what it takes to be accepted, even as children, and that this isn't necessarily happening at a conscious and cognitive level, but what we do to be accepted means oftentimes that we cannot be authentic. And so we're in this constant as humans, um, like juxtaposition of authenticity and acceptance, that we can't have both. And I was just thinking about how that like perpetuates out um, and from that relationship between parents and children into all sorts of other relationships where we're choosing, again, not necessarily consciously or cognitively, but maybe more emotionally, relationally, psychologically, between the feeling of being accepted and being authentic. I think one of the most beautiful things that we can do as therapists and counselors and professional helpers is create space where people can feel, and this includes children, people, is feel both authentic and accepted. And I can't think of a better way to do that than as a child-centered play therapist. So when you are really following the 8 basic principles that were outlined by Axline in the 1960s, when she developed child-centered play therapy, and that have are the tenets of what we do as child-centered play therapists, is that is essentially what you're doing. You're offering those children both acceptance and authenticity. And that may be the only place ever that that child feels that way. And I think one of the reasons this struck me so hard is that that may be the only place that anyone feels both acceptance and authenticity. And there's a part that makes me very sad, about that, but it also speaks to the responsibility that we have as clinicians. So when we are following the 8 basic principles, when we are following child-centered, person-centered, humanistic tenets of what therapy is supposed to be like, to accept people exactly the way they are, to be non-judgmental, to show up being curious and interested in what that person brings to the table. When we are doing that, we are offering people this unique experience of having them seeing themselves, having themselves be in a relationship where they can be both authentic and accepted. And to just sort of sit with that and let that sort of percolate for a minute is like what an amazing feeling that is. I hope all of you have that experience in some of your relationships where you feel both of those things. But I think it's important that we recognize that many people, even us as professional helpers, don't really have that experience. So how can we offer that? Certainly you can. if you have fidelity to a child-centered model of play therapy, you can offer both authenticity and acceptance. And you can do that in your clinical relationships when you stick to person-centered, humanistic tenets of the work. But you can also do that, and I just need to throw this in as somebody who cares a great deal about what we do as clinical supervisors. You can also do that as a clinical supervisor, is you can offer acceptance and allow for authenticity. So my dare to you today is really to think about how you do that, or how you can do that. How can you bring that to as many relationships as possible, including your relationship with yourself? How do you do both and authenticity and acceptance? Okay, I look forward to the next time we get to have one of these talks.